Hey y'all, how you doing? Interview questions, right? I know, been there, done that. So in today's video, we're gonna talk about how to sit for an interview for an employer. And for you guys who come to the States, this is gonna be beneficial. In this video, we're gonna talk about nurses sitting for an interview. But first, let's kick in the intro. Oh, there's no intro? Man. But first, pause the video. Put down in the comment section what is the most terrifying / difficult question you ever had in an interview. Tell me about yourself, right? I hate when they ask me that, but you know what? The answer is very simple. Start off by saying something personal about yourself and then jump into your career experience, your education. Well, when they ask me that question, the answer is pretty easy. Tell me about yourself. Well, my name is Mohammed. I'm married. I've got 2 boys. I've got a girl coming on the way. They say congrats. I say thank you. And then I jump into my career story. I'm a nurse. I've been a nurse for 10 years. I graduated in 2007 with a bachelor degree in nursing. I worked for 2 years in critical care. After that, I moved into pediatric oncology in this huge magnet facility. After a year, I got married. I moved to Saudi Arabia. I worked there for like 6 years. And then I moved to the United States, and I've been working here ever since. So it's pretty simple, right? Transitioning in your career story, 10 years in like 10 seconds. That's how you need to do it. You need to have it up here. You need to practice it. So practice. Don't get too much into details because later on you use your details to answer other questions. Second question, what's your hospital capacity? What's the capacity of your unit? Traditional question. You need to prepare the answer. So the aim of this question is to know if you know your hospital capacity, how many beds, how many employees, how many nurses. A small tip, always research the hospital you're applying to. Check their website. Know the unit you're applying to. Check their scope of practice. Know your job description. Read it very well. Be prepared. By doing the research on their hospital, that will show the employer that you're very interested with the position. So how do I answer that question? It's pretty easy. I just pick up a number. So I'll say, I used to work in the American University of Beirut. The capacity of that hospital is 400 beds. It has over 800 nurses and 1,200 employees in general. The unit I used to work at is 16 rooms with single beds. The nurse-patient ratio is 4:1. It's nice to know the nursing hours per patient days. That would show that you're interested in your quality indicators. So the NHPPD is 9.2, or just pick up a number. Question number 3. Tell me about a typical day on the unit. Key elements. You want to include key elements in your answers. You want to know what they're looking for. Punctuality, multidisciplinary teamwork, leadership skills, safety, collaboration, problem solving. They might even ask you, walk us through your last shift. In answering that question, nah. Prepare for that question. It's crucial. How do I answer that question? It is pretty easy. I start with punctuality. I start by saying, I always make sure I arrive to work 10 minutes early. As soon as I get on the unit, I check my extra assignment. So if it's crash cart, I go ahead and check my crash cart. Then I check the patients assigned to me, and then the whole team do a walking around for handover. So when we get to my patient, we endorse at the bedside, then I do my safety checks. I check the pump, the weight, the tubings, the fluids, the electrolytes, the suction, the oxygen, the side rails, the ID band, all that good stuff. Then I double check with the night nurse that all the night medication has been given and signed, and then I move on. Then when we finish the round, I go directly and check the diet list. Do all my patients have breakfast? And then the diabetic patients, do they have insulin before breakfast? If they do, then I go and prepare that insulin. And we do the double checks and we give the insulin at the bedside. And before the breakfast is on the floor, I go and do my head to toe assessment. I introduce myself. I ask the patient if they had a good night. Did they sleep well? Do they have any concerns? Are there any issues to raise to the physician or the multidisciplinary team? Are they having any signs or symptoms? I make sure the patient is comfortable. By the time I get out of the room, I know my nursing diagnosis. I have my plan of care all set right there. If I have time, I'll start charting. I'll document my physical assessment findings. If not, I'll just jump into my 9 a.m. medication administration. After my round, I follow up procedures. I check consents and approvals. Then I will sit for the multidisciplinary round. I'll be an advocate for my patients. I will raise all issues and concerns. Then I will carry any physician orders. Then insulin. Then lunch. Then medication rounds. Then I will regroup and check my nursing care plan again. Then insulin. Then dinner. Then handover. You'll walk them through your day with less than a minute. Be prepared. What are some of the cases on the unit? Narcotics. They'll be asking you about narcotics, sedation, inotropes. Tell us about them. Have you used them before? Give us examples. What are the doses? Major side effects, precautions, monitoring parameters. Prepare to give an example on every drug class. Narcotics. Speak about morphine. How easy is that? Inotropes. Speak about norepinephrine. How easy is that? Sedation. Speak about midazolam. How easy is that? Question number 6. Have you done electronic charting in the past? If you've done electronic charting, then that's perfect. They will love that. If not, don't just say no, I haven't, and just sit there. Any type of charting is okay. Some hospitals use electronic charting for blood work, for radiology. Mention that. It doesn't have to be totally paperless. And if none of that, it's okay. Just say that you're like a tech freak. You're very good with computers. You're a fast typer. You type like 80 words per minute. Just say something. We'll do one more question. Remember, the list is 20 questions. Question number 7. How fast can you type? Lie, for God's sake. Don't say 20 words per minute. Say, their minimum, what they're looking for is 35 words per minute. Say 35 words per minute. Even say 40, say 50, say 60. I'm not encouraging you to lie, but I'm giving you goals. Download a system to improve your typing, because typing is crucial in the United States. 7 questions are down, 13 to go, 20 questions on the list. Stay tuned for part 2. More interesting stuff to come. Put your comments down there. What are the most interesting, difficult, terrifying questions you ever faced in an interview? Because getting a job is not easy. You need to be prepared. You need to be an Alphaslice.
To get to anywhere, maybe we'll make a deal. Maybe together we can go somewhere, any place is better. Starting from